There we go. All right, we're set.
Okay. Well, I'm super excited that we decided to do this.
Yay.
It's definitely new territory for both of us, but
Oh gosh.
when we met up and we're just chatting in person, there was so much that I was like, gosh, I wish we could share this with the world. So I'm really glad we're doing this. So I'll introduce myself. I'm Dr. Sydney. I own Rooted Pelvic Physiotherapy here in Denver, Colorado. I do in-home services, one-on-one 60-minute sessions, and then also some telehealth as well. And I treat pregnancy, postpartum, as well as pelvic pain, vaginismus, vulvodynia, all sorts of different things, leakage, frequency, urgency, the whole shebang, so to speak. But my advanced training, I would say, is in pregnancy, postpartum, and pelvic pain conditions. And so I'll let Jessica chat a little bit more about herself as well.
Yeah, so I'm Jessica. I'm a licensed massage therapist, and my practice is TMJology. So my focus is on the adult population who is suffering from TMJ and jaw pain. So in my practice, I have in-office TMJ massage sessions that I do. So working the muscles from kind of the neck up, as well as inside the mouth, being able to do intraoral work. I also support patients after they have had tongue tie releases. So, working with them on their recovery with their scar tissue as well, and incorporating pre and post full body work. Because as we're going to dive in, everything's connected, from the top to the bottom. So, being able to help them with that post op care so they get full body recovery and not just from that tongue tie release. I also offer virtual care as well, doing like neuromuscular jaw and TMJ like movement therapy. So working on exercises to help better start coordinating and strengthening the muscles in the jaw that can also lead to having that TMJ and that jaw pain.
Awesome. So yeah, we decided to jump on today to talk about the different connections of the jaw and the pelvic floor. We've realized that in recent days, there's so much information out there that, people are putting influencers, social media that it just says, the jaw and the pelvic floor are connected. And we're like, okay, well, should we go into detail on how? And so we really want to be able to be those providers for you guys to be able to kind of really have the education on how those two areas are connected and what to kind of look out for in your own bodies. So I'll let Jessica start us out in, we're just going to kind of go topic by topic on different ways that they're connected and then go from there. So I know we've got some good ones.
Yeah, I would say probably the most popular one you're hearing right now on social media, at least that I'm seeing, is that deep fascial line. I feel like every post I see from any body worker, any provider is now bringing up that deep fascial line. So with that fascial line, it's connecting us, from the tongue down into the mid body, the torso, the hips, down into the feet. So when you have pain and dysfunction in the jaw, whether it's from years of clenching, it's grinding, our posture, when it begins to affect you up here, it's just going to follow down the midline. And sure enough, my patients come in. I know my initial eval checklist patients have told me like it's excessive because I'm asking questions that doesn't make sense. Why would I ask about their pelvic floor when they're in here to see me for their jaw? But it's always a good sign that if something's going on up here, there's something else going on, down in the pelvic floor, and our body's connected. So if I'm only helping you from the neck up, you're going to come back. Things are still going to be happening because we've got to address the whole body systemically when it comes to these issues. When that head is forward, whether it's, some airway related issues, a lot of people have more of that forward head posture to help open up their airway, or as we are all guilty of working in front of our desk and our computers, driving, we have that head bracing forward. And when your body has that posture thrown off on the top, it's got to compensate for the rest of it to keep you standing up straight there. And so with that, I have, patients coming in with jaw issues. The second I bring up issues with their pelvic floor, it's not just, people have had kids, it's beyond that, when it comes to that. You don't have to have kids to have pelvic floor dysfunction. I know I have it and I haven't had children and I need to come see you,
Yeah.
for the rest of my full body care, like, everyone else does. But Once I hear that, we know we've got to work together now, as these providers to really be able to help people with their jaw pain and their pelvic floor pain.
Definitely. Especially, I've seen a lot of patients, since I treat pregnancy, we see as belly grows, different postural dysfunctions kind of show up as there's just more weight going forward. You get the hyperextended knees and all that going on. But the same goes for a protruding jaw. So I see when people have that protrusion going forward, they see the hip flexors start to tighten up. And we just see a lot of that forward anterior tilting in the pelvis as well, which creates huge dysfunction for the pelvic floor, and compensation patterns as well. Another thing I'll bring up in terms of like very early on in life. So we were talking about how day 15 in embryology, we've got that neural tube and we've got the mouth kind of being formed at the same time as the urethra and anus. So, in utero, before you're even born, you're just a little thought at that point. We've got those connections already being formed. And so, of course, that's creating that, essentially fascial line in terms of what we're looking at. And then, another thing that I wanted to add too, with regards to the fascia, as well as just the body in general, when you look at midline, the TMJ, the sacrum, as well as the front of the pelvis all cross midline. And so those are our real main stabilizers in the body. And it's no secret, or, we just know that that's going to get tight and take the brunt of the force from different things. I know we talked before about like fight or flight. And so, if something scary is happening to you, or you're just really stressed out, you're going to get that gripping of the jaw, as well as a lot of times the hip flexors, butt gripping, so the glutes turning on. It's very common to see, and I think that a lot of patients have both. And we just live such stressful lives today.
Oh
There's
my
just so
God.
many, things going on, and so it's really empowering to be able to kind of know that and be able to say, oh my gosh, I don't need to be grinding my teeth all day.
Yeah.
And I don't need to be sitting all day. I can get up and do a little stretching, and I can do some breathing down into the pelvis. And we've forgotten how to breathe. That's another
Yeah.
really
Right.
big problem in general. The
Yes.
respiratory diaphragm, I feel like, connects both jaw and pelvic floor. And so it's something that we both, I'm sure, look at as like a major kind of linking point for both areas. And so I don't know if you want to talk more about the diaphragm a little bit, and I can add in too, but
Yeah. I mean, yeah, if you're not engaging that diaphragm, that breathing muscle, and you're using now all these upper accessory muscles or doing that short, shallow breathing, you see a lot of extra work coming from the shoulders, coming from the neck, and this is all so closely related. So when this is now starting to have to do a lot of work, it starts to affect that jaw. I always think the biggest surprise when I'm teaching patients about like their resting posture with their mouth, lips closed, tongue on the top of the mouth, and your teeth should not be touching. They should have a nice 2 to 4 millimeter freeway space. And I think for a lot of people, they're like, what do you mean my teeth aren't supposed to be together when I'm at rest? And the second those teeth come together, those big mastication muscles, they turn on, that bracing automatically happens, and it kind of just leads down to that bracing of that pelvic floor. I don't know about you, doc, but I know when I do intraoral work and patients will then be like, hey, I know I didn't like tell you, but like my left side of my hip feels better now, even though we didn't do anything with that. Just like releasing that tension up there works its way down, to the rest of the body. It's crazy that connection is there. And I don't know if you can dive into it a little bit more. I've been told kind of like with the diaphragm and the pelvic floor, it's kind of like a piston system, like, and how it works and the other. So can you dive in like a little bit deeper of how the diaphragm and the pelvic floor work together?
yeah, definitely. And so I always start sessions, every single session, no matter what the patient's there for. I start with a suboccipital release and doing some stuff to the head and neck, and just to see kind of like what's gripping, what do I already kind of determine is at play here, as well as it's just so calming and relaxing for patients. And so it already just relaxes the nervous system a little bit so that I can dig in a little bit deeper to some of the postural muscles and everything like that. But in terms of the diaphragm, and pelvic floor. You know, a lot of people talk about the respiratory diaphragm. They don't realize that there's also a pelvic diaphragm.
Yeah.
And yeah, and even a diaphragm by the jaw. But yeah, talking about specifically the respiratory diaphragm, as you take a breath in, you're bringing air into the lungs. The diaphragm should descend.
Mhm.
And then and then pelvic floor also should go with it. And not bearing down, but just relaxing. It's in a relaxed state there. And then as you exhale, diaphragm comes back up. That's when the pelvic floor should lift. And then in terms of the belly, the sides of the ribs, the back, you know, there's also a lot of misinformation out there as to, oh, well, when you take a breath in, you should push your belly out. And it's like, no,
Yep.
no, 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 no. Please don't say that. I'm going to fall off my chair. Like, we are not pushing our bellies forward. We are not, you know, flaring our ribs. We're not breathing straight into the belly, especially with patients with like diastasis and things like that. Like, that's the worst thing that we could possibly do, is be pushing more pressure forward. And so really we want to have a nice breath that feels like you're opening an umbrella, or my favorite is blowing into a balloon. The balloon's expanding in every direction. And so we want to take that breath in, have the ribs be able to be mobile to move out in all directions. We have kind of a pump handle as well. So we come in both directions here.
Mhm.
And we also want to see pelvic floor being able to move up and down. And so it's not just about, you know, pushing into the belly. We need to also have back breathing, which I think is something that gets lost in most people. So that front and back motion of the breathing. And so, you know, if they're not able to breathe properly, everything else kind of gets to be dysfunctional. And so that's kind of the major thing that we see with pelvic floor and diaphragm. And so we do a lot of diaphragm work to try to get the diaphragm working properly, a lot of myofascial release, which goes back into that frontal line again.
Well,
And so yeah, it's really great when someone learns how to breathe. It takes a while, but they're like, oh
right?
my gosh. And I don't know if you've seen this too, but unfortunately, especially amongst women, we see that, you know, we've kind of been taught from a young age, oh, like, you know, we want you to have a nice flat belly. You got to suck
Yeah.
in, and you never even think to like allow your belly or your ribs or your back to expand, because we just want to be in this little space of like a corset. And like the truth is, like, you're never going to have a flat tummy or, you know, good
Yes.
deep core activation if you can't take a breath in to support that. So super interesting for sure.
Yeah, I mean, I know just for myself, you know, as a, you know, TMJ massage therapist, I learned about myofunctional therapy. And so, you know, taking that course and, you know, learning about those concepts. And a big part of them is learning, you know, that nasal breathing, because that nasal breathing, it what keeps us in that rest and digest, you know, that nice, calm, you know, phase. You're not stressed or anything. And so when we naturally just do shallow upper chest breathing, that fight or flight response just naturally turns on, you know. So when you can really start to re-educate yourself, you know, and your muscles to start applying that diaphragm breathing, it's amazing for me how much more calm I felt. Like a lot of my anxiety really just was able to come down by simply learning that diaphragm breathing, that lip seal, and incorporating that nasal breathing. So it's huge. We kind of think when I ask someone, I'm like, oh, can you breathe through your nose? I'm like, oh, yeah, sure, no problem. And then I'm like, okay, well, show me. You know, a lot of really short, shallow breathing. So our bodies are really good at keeping us alive. Our bodies wanna wake up every day, and even though it might not be the right way to do it, it's going to make it happen. So, I feel like a lot of more of my massage and the education I do is that it's re-education when it comes to these
Right.
dysfunctions.
Yeah, and so like the shallow breathing again with the diaphragm, like if you're not taking a deep enough breath in, then the diaphragm's always in a shortened position. It can never fully come down. And then the pelvic floor also can't come down because they really are that related. It's like an elevator or canister system. And another thing I was going to mention based on what you mentioned before with the teeth is a lot of times we also see patients that are like, oh, I'm fine. Like I don't have any symptoms at all. You know, everything is great, but they breathe with their teeth touching.
Yeah.
and they bear so much pressure down, these upper ab grippers, we call them. And I was one of them earlier on in my life.
We're always
And
our
so,
first patient.
yeah. And I'm like, uh-oh. But yeah, so if you're taking a breath in, you're gripping, the jaw, you've got some of that accessory muscles turning on, and you're pressing down with the ribs to try to kind of contract the core, you're going to have that lower belly pooch, maybe accentuated C-section shelf or something like that. And you're going to have so much pressure down on the pelvic floor, and it's trying to lift up to kind of, bear the pressure, but it's not going to be able to sustain everything on top of it. And so a lot of times we see the upper ab gripping. And so I, suggest anyone that's watching to really take a look at your breathing and see, are you breathing in all directions? As you exhale and tighten the core, are you getting a flattening out of the abdomen, or do you see that little pooch? And if that pooch is there, reach out to us, because likely we've got some stuff going on. And so yeah, looking at some different patterns too in the body, it's really fascinating. And then jumping off that real quick with, in terms of the sympathetic nervous system, and the pelvis, we see the psoas muscle as like a major, muscle in the pelvis that gets, or the hips that get really tight. And they pass, right by the sympathetic nervous system, as well as right in the area of all of the lumbosacral nerve roots that are coming out. And so I really love to be able to release the psoas, both sides of the muscle together, being able to really get everything to relax so that the nervous system is in a little bit of a better spot. So I do that, and my suboccipital work on every patient.
Yeah.
Definitely.
I love it. We both start our sessions the exact same way
Yeah.
with suboccipital release. Like, it's the best way to start like every single session, like doing that, practicing that breathing, like couple of minutes of that, and it's a lot easier to work, on patients, just how quickly it relaxes them to be able to dive in like into that deeper work there.
Definitely. So I don't know if you want to talk a little bit too about, what kinds of things, we've already touched on a little bit, but what types of things do you see, with your patients when you're doing a full, session, that you're like, oh gosh, like you might want to check out your pelvic floor a little bit more.
Yeah. So I mean, well, a lot of my stuff, with the intake form, like, bracing, addressing, the nervous system, obviously immediately if, they've had children, any kind of accidents or injuries, to the pelvic floor, those are going to be, my big signs, to send them over, to you to have them, worked on. If I see a lot of bracing, as a lot of my work, is Thai massage as well. So incorporating a lot of that. So working on that mobility, with the diaphragm, with the rib cage, and getting that range of motion. So those are kind of like, as I'm going through that checklist, like my not so really red flags, but like, oh, like, yeah, you've got to go over here, and work with Dr. Sydney as well.
Yeah. Yeah. So I see all sorts of stuff too. And it's interesting because, of course, that's probably later on in your sessions that you get to like further down in the body. And for me, it's like towards the start of my session when I'm doing that suboccipital work that I tend to think, I may have a candidate here for Jessica. And so, depending on how much tension I feel in the neck, I always kind of ask about the jaw, especially when I'm treating a patient with chronic pelvic pain as well. And a lot of them don't realize that there's, people like you out there that can help them. And so they're like, oh yeah, I get these horrible flare-ups, but then they go away, or like, oh yeah, I use a mouth guard or this or that. And so it's, that's obviously the first sign, just subjectively. But of course, when I look at breathing, are they shallow breathing? Are all of these muscles turning on? What's going on at the abdomen? Sometimes we see pretty much nothing, going on at the abdomen with breathing. And so, maybe I'll wait until the second session and be like, okay, let's work on this and see, what happens. But a lot of times it just doesn't change. It's just stuck. And at that point, we do need to like address what's going on, in the face and the jaw and the TMJ. And so, that's of course a big one. And then also I had a patient yesterday who's a chronic mouth breather, and she didn't even know it. Like, she had no idea that she breathes with her mouth. And I'm
Yeah.
asking her to take a deep breath in through her nose. Actually, we were doing hypopressive work. And so that requires like a pretty big breath in and then an exhale, full exhale, in order to do like a scooping motion. And she couldn't take a breath in through her nose. And this was only our second session. And I think she had gotten the hang of it the first one, but totally just, things went haywire from there. And it was just a question of like, how often do you breathe in through your mouth and out through your mouth? And she looked at me like, that's all I do. And I'm like, okay, so yeah, that's, that's not how we want to go through the day. And so, it's one of those things where when you're doing that so chronically, like I'm not going to be able to just say, oh, breathe through your nose. And like, that's the end of the
Yeah,
story. Like, there's so much more at hand there that I am not, that's not my scope of practice. My scope of practice is
yeah,
to medical screen and say, this isn't right. And this is not, useful for our sessions and not useful for your life. So, I'm glad to have you in my network to be able to refer patients like that too. And then the other time I see it a lot, and maybe we don't necessarily target it during these sessions, but I'm like, okay, we've got something at play here is during birth prep with patients as we're practicing pushing. There's 3 different types of breathing that we go over: open glottis, semi-closed, and closed glottis breathing. We don't really practice the third one, but we just kind of tell them it exists in order to, be transparent about the birth process. But with regard to the other types of breathing that we practice, we do see a lot of times that patients start to clench the jaw as they're trying to practice pushing,
yeah.
versus keeping the jaw open and sometimes making deep sounds. And, working through those things can help just for the birth process. But a lot of times postpartum, I have that in my head of like, okay, that was a patient that really gripped their jaw a lot.
Mm.
What's going on now postpartum that might be of concern with the TMJ. So,
Yeah,
yeah.
I definitely know when I spent a whole year of doing just pre and postnatal, clients, working with them. And sure enough, I would get up into working, into those masseters, I'd get into that temporalis and I'd be working on them and I'd be like, do you happen to clench or grind your teeth often? And they're like, how'd you know? And I'm like, signs, like if I can feel here, and everything like that, when it comes to working on them. So again, it's if you've got TMJ and jaw pain, you most likely have pelvic floor, pain and dysfunction, but you just don't realize it because you've lived with it for so long, and until someone starts asking the questions and you start to like turn, you flip that switch for them, it's just like, oh, like I see now why you want me to go see all these, other providers. If you have the ability to, the time, the finances, it really does tie it all together with your full body treatment.
Definitely. So how is it best for patients or potential patients to reach out to you? If
Yeah.
they're watching this and they're like, oh my God, that's me.
Yeah.
What do I do now?
So, I have my website, www.tmjology, so tmjology.com. So you can go there. I have a lot of free resources for you to access as well if you want to learn a little bit more on your own. And then as just a contact section, you can go there. I always respond to on my Instagram page. So my handle's at tmjology. You can send me a message there and we can dive into a little bit deeper. I have free 30-minute discovery calls that I do with patients, so don't feel like, oh, I'm gonna have to dive all in deep. No, like let's just chat, let's see what's going on, because like I tell people, I might not be the first person you start with. Like you said, for someone who can't breathe through their nose, it's going to be very difficult for me to be able to help you with your jaw pain and working with your muscles, because I need you to be able to have that tongue to the top of the mouth, those lips sealed, and you breathe in through your nose. And if you can't do that, it's going to make your treatment a lot harder to be successful.
Definitely. And I actually want to just end real quick before I tell people where they can find me on, if you try that right now, closing your lips but keeping the teeth apart, and then take your tongue on the roof of the mouth and kind of bring it back just a tad, see what that does for your posture. Because it I give this to patients all the time when they're struggling with pressure. If you bring that tongue back just a little bit on the roof of the mouth, it automatically takes you out of that front posture, forward head posture. And so
Mhm.
it's always a good tip when you're, here over the computer all day, like thinking about, okay, what's going on with my mouth? Can I sit up a little bit straighter coming from here?
Yeah.
And so that's great. And I also do free discovery calls. And I have some free resources, which I think the most important one for anyone watching this would be, I have a self pelvic floor assessment page on my website. That's a free guide. And so you can check that out as well. And my website is www.rooted, ROOTED, pelvic physio. So not physiotherapy, but physio, PHYSIO.com. And you can also find me on Instagram, also with that abridged name, so Rooted Pelvic Physio. And I message Jessica just about every week with a new question or a new need. So
We both do. We're both learning from each other. Like
so we
it's
are,
amazing when you tell me something. I'm like, what?
yeah. So we are definitely present on Instagram.
Yeah.
So if anyone has just a random question, feel free to DM us. And yeah, this was so great. Definitely give feedback. Also, if you want us to come back on and do some more, we have a million other references we can,
Oh my goodness.
share. And
Yeah.
yeah, this could go
This
on
is just the
forever.
surface.
Yeah. Awesome. Well, I'm good in terms of having anything else to say, but if you have anything else you want to add before we get off, that's great too.
No, I'm good. It's good. I'm so glad we did this for us and just for everyone else to get to learn this material.
Yes, me too. I'm like, is this my 30-minute discovery call?
Yeah,
Because I,
right? It's exactly how it goes.
yeah, right. Awesome. Well, I am so glad we did this too, and we'll chat soon.
Yeah. Bye, Doc.
Bye.